Arachnophobia. Arachnophobia is the fear of spiders, and it is one of the most common phobias in the world. For many people, even seeing a tiny spider across the room can trigger panic. The fear often comes from how spiders move, their long legs, or the idea that some species are dangerous. Movies and stories have also played a big role in making spiders seem more threatening than they really are. Even though most spiders are harmless, the fear can still feel completely real to the person experiencing it. Acrophobia. Acrophobia is the fear of heights. Some people feel uneasy standing near a balcony or looking down from a tall building, but with acrophobia, the reaction becomes much stronger. A person may feel dizzy, frozen, or unable to move safely. The brain reacts as if falling is about to happen, even when there is no real danger. Elevators with glass walls, bridges, rooftops, and even escalators can become difficult situations for someone with this fear. Claustrophobia. Claustrophobia is the fear of tight or enclosed spaces. Elevators, tunnels, crowded rooms, and airplane cabins are common triggers. People with this phobia often feel trapped, even when they know logically they can leave. Breathing may become faster, and panic can build quickly. The fear is connected to losing control or not being able to escape if something goes wrong. In severe cases, a person may avoid public transport or busy places entirely. Aerophobia. Aerophobia is the fear of flying. Some people worry about turbulence or crashes, while others feel anxious simply being inside an airplane. The lack of control during a flight can make the fear worse. News coverage of rare plane accidents has also increased anxiety for many travelers over the years. Even though flying is statistically very safe, the experience of being high in the sky inside a closed cabin can still feel overwhelming. Nyctophobia. Nyctophobia is the fear of darkness. It is especially common in children, though many adults experience it too. In the dark, the brain cannot clearly see what is around, so imagination often fills in the gaps. Shadows, unfamiliar sounds, and silence can suddenly feel threatening. This fear likely comes from ancient survival instincts, when darkness made humans more vulnerable to danger at night. For some people, sleeping without a light nearby feels impossible. Ophidiophobia. Ophidiophobia is the fear of snakes. Even people who have never seen a snake in real life can still react strongly to pictures or videos of them. The way snakes move silently and strike quickly makes them deeply unsettling to many people. Scientists believe humans developed a natural awareness of snakes long ago because some species were deadly threats. Today, that instinct still remains, even in places where dangerous snakes are rare. Cynophobia. Cynophobia is the fear of dogs. Unlike a simple dislike, this fear can cause panic when a dog approaches, barks, or even appears behind a fence. Sometimes the fear begins after a bad childhood experience, such as being chased or bitten. Other times it develops simply from watching others react fearfully around dogs. Since dogs are common in parks, streets, and homes, the phobia can affect everyday life in a major way. Trypanophobia. Trypanophobia is the fear of needles and injections. Hospitals, blood tests, and vaccinations can become extremely stressful events for someone with this fear. Some people feel faint or dizzy at the sight of a syringe, while others avoid medical care entirely. The fear is partly linked to pain, but also to the idea of something sharp entering the body. Because medical treatment often involves needles, this phobia can become dangerous if it causes people to skip important health care. Thanatophobia. Thanatophobia is the fear of death. This fear can involve worrying about dying, losing loved ones, or simply thinking about what happens after life ends. Unlike many phobias, it is tied to thoughts rather than a physical object. Moments of illness, aging, or major life changes can make the fear stronger. Almost everyone thinks about death at some point, but for people with thanatophobia, those thoughts become constant and deeply distressing. Mysophobia. Mysophobia is the fear of germs and contamination. A person may wash their hands repeatedly, avoid touching surfaces, or feel anxious in crowded public places. The fear became more visible during global disease outbreaks, when concerns about hygiene increased everywhere. While cleanliness is normal and important, mysophobia pushes those worries much further. Everyday objects like door handles, phones, or money can suddenly feel unsafe. Social phobia. Social phobia, also called social anxiety disorder, is the fear of being judged or embarrassed in social situations. Speaking in class, eating in public, or meeting new people can create intense stress. The fear is not simply shyness. Many people with social phobia replay conversations in their minds and worry constantly about making mistakes in front of others. Over time, avoiding social situations can lead to loneliness and isolation. Agoraphobia. Agoraphobia is the fear of situations where escape feels difficult. Crowded malls, buses, open public spaces, or long lines can all become overwhelming. Some people fear having a panic attack in public and not being able to leave quickly. In severe cases, a person may stop leaving home almost completely. The condition can slowly shrink someone's world, making ordinary activities feel impossible. Emetophobia. Emetophobia is the fear of vomiting. People with this phobia may avoid certain foods, restaurants, travel, or anyone who appears sick. Even hearing someone cough nearby can create anxiety. The fear often grows from a past experience with severe illness or embarrassment connected to vomiting. Because stomach sickness is unpredictable, the person may constantly try to control every detail around them to avoid the possibility. Glossophobia. Glossophobia is the fear of public speaking. Standing in front of a crowd can cause shaking, sweating, and a racing heartbeat, even for experienced adults. The fear usually comes from the pressure of being watched and judged by others. School presentations, business meetings, and speeches are common triggers. Many people with this phobia know exactly what they want to say, but anxiety makes it difficult to speak clearly once attention turns toward them. Hemophobia. Hemophobia is the fear of blood. Unlike many other fears, this one can sometimes cause a sudden drop in heart rate and blood pressure, leading people to faint. Blood tests, injuries, and medical scenes in movies can all trigger strong reactions. The fear may come from the body's instinctive response to injury and danger. For some people, even discussing blood is enough to make them uncomfortable. Entomophobia. Entomophobia is the fear of insects. Cockroaches, bees, ants, flies, and other bugs can all trigger panic. Insects move unpredictably, appear suddenly, and are often difficult to control, which makes them especially stressful for some people. Horror stories and exaggerated reactions in media have also added to the fear over time. Even harmless insects can feel terrifying when the brain treats them as a serious threat.